So, a good day to everyone. Last video lecture on ruminant production, I've discussed about the different herds of beef cattle. I've discussed the division of herds. So, pag sa herd mo, pwede mong i-divide yung mga nandun na animals based on their purpose. So, pwedeng yung isang group, pwedeng nandun lahat yung mga breeders, nandun lahat yung mga lactating or pregnant cattle mo. And then for the other group, for the other division, nandun lahat yung mga breeder bull mo. And then for the other division, nandun lahat yung um, mga fattening mo. So with that, with the herd division, um, all of those, despite yung mga differences nila, despite kung ito man ay isang breeder, ito man ay isang lactating, ito man ay isang pregnant, ito man ay for slaughtering, lahat nito, they are subjected to parang yung health management. So for this video lecture, I'm going to talk about the beef cattle health and diseases. So I will going to discuss what are the diseases, the common diseases of beef cattle. So, so with that, when we say disease, it is any change in the structure or function of an animal's body which interferes with the animal's intended purposes. So basically, any change that are detrimental or that are negative, that that can negatively affect the production of the animal. Any change in that, in the structure or function of the animal's body, then that is considered as a disease. So changes can vary. So it could be physical change, pwedeng nangangayat, pwedeng hindi na niya maigalaw yung isang paa niya. So pwede rin na may change doon sa function. So pwedeng hindi na nakakapag-produce ng nutrients, hindi na siya nakakapag-absorb efficiently. Basta any changes that are negative that can affect the production of the animal or in this case yung beef cattle natin, that is considered as a disease. So uh, we have here the outcome of the disease. So, by the way, this parang PowerPoint or this parang contents of my PowerPoint was leave through a website. So, I will be uploading that website doon sa MVLE. Pero, uh, yung outcome of disease, according to them, you have four. So, first is recovery. Second is chronic illness, then third is carrier animal, and then death. So when we say recovery, then one of the outcomes of disease, especially when you did health management, if you treated the animal, then it will the outcome of the disease will be recovery. So magre-recover yung animal. Since trinit mo siya, binigyan mo siya ng medication, then eventually magre-recover rin yung animal. Then another one is chronic illness. So that disease will worsen, mag-worse siya into chronic illness. So pwedeng mas malala na yung condition ng animal that any treatment, any medication, hindi na nararamdaman ng animal. Kahit bigyan mo pa ng medication, kahit bigyan mo pa um, ng or kahit mag-practice ka pa ng health management, if it's like chronic illness na, medyo wala nang effect yung mga binibigay mo, wala nang effect yung health management. So that's the second outcome for the disease. Then another one is carrier animal. So pwede na the beef cattle was affected by the disease, then there is a high chance that that affected beef cattle can become a carrier to other animals, to other cattle in the herd. So, pwede yun yung outcome ng disease. Yung beef cattle naapektaran ng disease, and then if that disease is parang transmissible, na nakakahawa, then pwedeng maging carrier yung beef cattle na um, naapektaran ng disease na yon. So yun yung third outcome for the disease. And then for the fourth outcome, which is yun na yung death. So either one, pag masyado nang malala yung disease and then naging chronic illness and then hindi na talaga, wala nang medication, wala nang any health management na makakapag-recover sa kanya, then eventually the health of the animal will deteriorate and then eventually it will lead to death. So for the outcome of this is obviously yung kailangan natin or yung aim natin dito sa mga outcome of disease kung pagpipilian is recovery. So kailangan mag-recover yung animal. And then ito yung tatlong ito yung iniiwasan natin, especially death. So pag namatay yung animal, then sayang lang yung binigay mong input, sayang lang yung binigay mong feeds, sayang lang yung effort mo dun sa mga management practices if mamamatay lang yung animal. So for the signs of diseases, actually this is like a general signs of the diseases. So you could look more further or you could look further more intensely dun sa mga signs niya in order to parang identify properly kung anong disease yun. Pero in general, these are the signs of diseases. So first is depression. So when we say depression, yung animal parang dito sa picture, dull appearance, yung head niya is lowered and then ears drop. Meron na rin ganon. So that's one of the signs of diseases. And then another one is lack of appetite. Kung hindi kumakain yung animal, most probably it is a disease. It is caused by a disease since one of the parang instinct ng animal is to eat, kumain. So para may energy siya, para may nutrient. Yun yung instinct niya. So if yung animal hindi kumakain, like for example, 2 days nang hindi kumakain, then most probably it is caused by a disease. Then it is isolated from the herd. So maraming reason kung bakit siya na-isolate from the herd. So one example is that he is too weak, lethargic na siya, hindi na siya makatayo. So na-isolate na siya. Kung saan pumupunta yung mga kasama niyang beef cattle, hindi na siya makakapunta kasi nga may disease siya. He is too weak to move, parang ganun. So basically na-isolate siya. Then another one is abnormal posture. So this is where observation comes into place. So pag ino-observe mo yung mga animal mo, yung mga beef cattle mo, and then may napansin ka na parang iba yung posture when compared dun sa mga ibang animals on the herd, parang pag-ewang-gewang ganun, and then parang different siya. Different yung posture na compared to the other animals on the herd, then most probably it is affected by a disease. Then another one is diarrhea. So specifically, pag mga ganitong diarrhea, it is caused by mga bacteria, mga bacterial infection pwede. Or pwede rin virus. So yun. Kasi itong diarrhea, it is not normal. It is hindi yun yung norm ng animal. Hindi yun yung parang tae ng animal. If it is diarrhea, if it is watery subject, parang symptoms ng diarrhea, then the animal or the beef cattle is have a disease. Then another one is rapid breeding. Maaari na the beef cattle is affected by like respiratory disease, mga ganon. Then merong rapid breeding na nagaganap. Then nasal discharge. So pwede rin nasal discharge. So yung parang may mucus doon sa nostril, then It is also a sign of disease. And then lowered production. So kung pansin mo, parang mas lower yung production niya, then maaari na cause ng disease. So yun yung mga general signs of diseases. So for the diagnosis, for beef cattle to so you could take the animal's temperature. So yung parang common na pagkuha ng temperature ng animals, specifically or especially itong mga beef cattle, itong mga cattle is through rectal na sa rectal temperature niya. So yung normal temperature niya nagre-range from 38.04 or sabihin na lang natin 38 up to 39 degrees Celsius. So yun dapat yung makukuha mong range into the sa rectal temperature niya. So anything above this range, anything above this value, then maaari na may sakit yung animal, may sakit yung cattle. So please remember this value and then you could perform a physical exam on the animal. So pwede rin na tignan mo maigi yung animal. So baka sa pag-o-observe mo ng malayo, hindi mo makikita talaga mismo yung animal. Hindi mo talaga ma-view yung the whole animal if you do not perform physical exam. So tignan mo yung mga mata, tignan mo yung nostril, tignan mo yung ear, kung baka may infection, mga ganun. So in diagnosing a disease, you really need to perform physical exam. And then you need to pay attention nga tulad ng sinabi ko doon sa mouth, sa nose, eyes, doon sa other, baka may MMA syndrome siya, sa vulva and then sa skin. So with that, there is what we call as the general principles of health. So we need to take into consideration itong mga to when performing management practices regarding health. So first is nutrition and then housing. Then third is sanitation and then regular observation. So in nutrition, I will not be discussing like yung kung ano yung mga kailangan natin ipakain, mga ganun, since it is a different topic. Pero in health management kasi, kailangan tong nutrition. So, it is an important factor dun sa health ng animal, yung nutrition. Since dito ka magpro-provide ng kailangan na nutrients ng animal in order for it to function properly. And when we say function properly, then the animal needs nutrients in order to combat mga diseases. So, first, you need to provide the necessary nutrients requirement with each stage of the beef cattle. So, kailangan na i-provide mo yung saktong nutrient requirement, yung kailangan na nutrient requirement ng beef cattle in every stage. So, when we say in every stage, iba-iba kasi yung nutrient requirement for a suckling calf, iba yung nutrient requirement ng lumalaking calf, iba yung nutrient requirement ng pregnant cow, iba yung nutrient requirement ng breeder bull, mga ganun. So, kailangan na you provide the necessary nutrient or yung tamang nutrients doon sa mga alaga mong cattle. Then, sinasabi dito that in the principle of nutrition, cattle in a good body condition are better able to resist diseases. So, pag daw maganda yung body condition ng animal, ire-resist niya or hindi siya makakakuha ng disease, resistant siya sa disease. So, with that, kailangan talaga na mag-provide ng magandang nutrition para it will result to a good body condition ng animal, ng beef cattle natin. And then, cattle in good body condition are better able to defend against parasites. So, same principle, pag good yung body condition ng cattle, then it could be able to defend against parasites. Then proper housing is essential for good health and disease resistance. So dito naman sa housing, kailangan rin hindi lang pwede na nutrition ka mag-focus tapos yung housing niya hindi naman nakakapag-provide ng shelter doon sa beef cattle mo, hindi pag umuulan, tumutulo naman yung tubig ulan, so mga ganun. Then, kailangan rin na maganda yung housing mo, maganda yung ventilation, maganda um, yung space requirements. So, yun, dapat proper housing is essential para maganda rin yung good health and disease resistance ng animal. Since improper housing, it can lead to many stresses. So, pag improper yung housing mo, tapos bumagyo, then it could lead to stress dun sa animal. So, when the animal is stressed, hindi lang sa beef cattle, almost all of the animals, if it is stressed, then it is more susceptible to diseases. So, kailangan na proper housing is, yun yung parang pagtunuan, yun yung parang kailangan natin proper housing para ma-minimize yung stress, para maging comfortable yung animal. And then para for good health and then for disease resistance na rin. Then, proper housing should be ventilated and dry. So, kailangan na ventilated kasi sa diseases, hindi lang kasi caused by bacteria and mga virus eh. Pwede rin it is caused by the environment. So, the housing should be well ventilated kasi pag hindi well ventilated, then iinit yung loob ng housing. Then if mainit yung loob ng housing, then it could lead to heat stress. So heat stress can lead to many diseases. Pag heat stress kasi, it will lower the feed intake of the beef cattle. So pag ni-lower niya yung feed intake ng beef cattle, hindi na makakakuha ng proper nutrition yung animal, yung beef cattle. So it will lead to disease eventually. And then the housing should be dry. So yun, kailangan talagang walang parang wet na part. Kasi ito pwedeng pamugaran or pwedeng uh, maging proliferation area ng mga bacteria, ng mga pests, mga flies, itong pag wet yung housing mo, pag may wet na part. So, dapat dry. And then, we go to sanitation and disinfection. So, dapat yung mga water trough, yung mga feed bins, herrings should be cleaned regularly. So, basically, almost all of it, feed holding equipment, needles and syringes, lahat na lang, basta lahat ng equipments that are used on the farm should be sanitized and disinfect regularly para walang pupuntang bacteria, walang mabubuong bacteria, mga ganun. So, kailangan na you practice sanitation and disinfection. Then, regular observation. So, this is critical to the well-being of the herd. So, kailangan na talagang every now and then, dapat nag-observe ka doon sa um, conditions ng mga beef cattle mo. So, the earlier a problem is noted, the more likely it can be successfully treated and controlled. Kaya, dapat regular yung observation mo para makita mo ng mabilis na pag nag-observe ka, oh, ito pala, parang may disease siya, parang abnormal yung posture niya, parang nanghihina siya. Then, with that observation, then pwede mo nang i-treat. So, mas parang higher chance na makarecover yung animal if you observe yung disease early. Kasi pag nag-observe ka lang, lamya-lamya na yung animal, hindi na makatayo, parang ganun. Then, maybe it's too late na. Mahirap nang mag-recover yung animal. So, dapat, you need to practice regular observation. Then, with that, you go to biosecurity, which is parang interchangeable or parang connected dun sa disinfection. So, disease prevention focus on stopping the introduction of those disease-causing organisms into a herd as well as stopping the spread within the herd. So, yun yung biosecurity. Kailangan, yung aim ng biosecurity is to stop yung introduction ng isang disease doon sa animal. So, maraming pwedeng gawin when it comes to biosecurity. So, pwede kang maglagay ng foot bath in order to disinfect anything. So, pwedeng maglagay ng yung Like for example sa VenV, pagpapasok ka, meron kang um, pupuntahan na parang shower before you could enter yung main area, yung main premises ng farm. So, mag-shower ka muna, magdi-disinfect ka. And then, another one that they practice when it comes to biosecurity is that hindi sila ah, naglalabas-pasok. So, yung mga empleyado dapat nakapermi lang doon. So, kumbaga, every month, mga 2 days, 4 days lang sila pwedeng lumabas para maiwasan yung courier or para maiwasan yung spread or para maiwasan yung introduction ng disease na yun doon sa farm. So, ganun yung ginagawa nila. And then, as well as stopping the spread within the herd. So, dito pumapasok yung cleaning, disinfection, and sanitation. And then, dito rin pumapasok yung pag may nakita kang may sakit, then you need to quarantine it. So, yun. That's for biosecurity. Then, decreasing or preventing the spread of body fluids. So, yun rin yung isa. Sa cleaning and disinfection, you decrease and prevent the spread of body fluids. And then, prevent the movement of diseased animals or other agents into the herd or elsewhere. So, yun rin yung pwedeng gawin sa biosecurity. You prevent the movement ng mga animals. So, dito mo siya i-quarantine. Ilalayo mo siya away from the herd. That's one of the practices on biosecurity. Then with that, let's go to the common diseases of beef cattle. So basically, may maraming diseases of mga ruminants dun sa cattle. And if you want to know more, if you want to go further into yung mga diseases, then I suggest na you go into Google, you can search maraming articles, maraming references dyan that will talk about itong mga common diseases. So here I lifted this also on the website. So first is the black leg. So the agent is Clostridium chauveau, tinatawag. So for the signs, sudden often severe lameness, hindi makatayo, parang ganun. Dead animal, and then gas in tissues causing crackling. So parang may gas daw dun sa tissue na pag ginalaw mo or tinouch mo, parang mag-crack-crack. So yun yung black leg. So for the treatment, it is pwedeng penicillin, and then prevention, vaccinate. So for bovine viral diarrhea or BVD, yung agent niya is BVD virus. So for the transmission, contact, which is fairly common when the disease is caused by a virus. Talagang in close contact ka. Pag close, yung contact with another disease, beef cattle. So yung signs niya, fever, anorexia, depression, and then diarrhea, as can observe on the picture. Ulcers in mouth, pneumonia, abortion, pwedeng birth defects, persistent infection, and then if possible, death. So pwedeng it can cause death. So for the treatment, none. So yun yung isang problema when it comes to viral diseases. Medyo wala kang treatment na masasabi na talagang parang it will cure the animal. So may mga treatments like providing yung mga vitamins in order to combat the disease. Pwedeng ganun. Pero yung direct na maapektuhan yung virus, wala. So yung gagawin mo is prevention talaga, which is to vaccinate. Kasi nga, viral diarrhea. So virus to. So another one is Footrot. So agent is a bacteria, which is yun yung Fusobacter na tinatawag. Transmission often secondary to an injury. So pag na-injured yung animal, so like for example dito, na-injured dun sa foot niya, and then yung bacteria pumasok dun sa injury, yung sugat niya, it will allow the organism or the bacteria to thrive dun sa sugat. So this will cause itong foot rot na tinatawag. So for the signs, lameness, swelling of the foot, foul odor. Then for treatment, since it is a bacteria, antibiotic. and then clean and dry the hoof. So pwede mong i-clean pwede mong linisan yung hoof and then make sure that it is dry. Then prevention, one is sanitation para mawala yung bacteria, foot bath, and then decrease yung stocking density. So those are the preventions. Then you also have infections, bovine rhinotracheitis. So the agent is the herpes virus. So transmission, contact with another diseased beef cattle or aerosol or through air. So signs, abortion, pneumonia, nasal discharge, conjunctivitis. So when we say conjunctivitis, parang runny eyes. Then nasal discharge, as you can see on the picture. So for the treatment, none, since again this is a virus. Then the prevention is through vaccination. Then you also have leptospirosis. So the agent is bacteria. Transmission, it came into contact with the animal, especially if it is parang sugat or wound. Then ingestion. So pwede rin na-ingest ng beef cattle yung infected na feed. Pwedeng na-ingest niya yung bacteria. Then signs, abortion and jaundice. So yung leptospirosis treat is through tetracyclines. And then for prevention, you could vaccinate yung and then rodent control na tinatawag. Kasi most probably yung bacteria kasi it can yung host niya pwede yung mga rodents, yung mga mouse. So yun yung gawin mo. You prevent it. Yun yung prevention. Then another one is grass tetany. So yung cause ng grass tetany, it is not by a bacteria, it is not by a virus, but it is from yung nutrients mismo. Insufficient nutrients, particularly insufficient blood magnesium. So for the signs, nervousness, so parang agitated yung animal, difficulty walking, iba yung parang normal na paglakad niya, apparent blindness, so pwede rin convulsions, and then it could lead to death. So for the treatment, you have magnesium solution given intravenous. So yun. Since yung cause is through lack of blood magnesium, yung treatment mo, supplyan mo ng magnesium solution given intravenous. So, and then prevention, proper nutrition, and then MG supplements. So, kailangan na proper yung nutrition niya, kailangan na nagbibigay ka ng sufficient na magnesium dun sa animal in order to prevent grass tetany. And at the same time, magsusupplement ka rin ng magnesium. Then, we go to the parasites. So, itong mga parasites will cause all sort of diseases dun sa animal. So, we have internal and then external. So, when we say internal, gastrointestinal, pwedeng nandun sa gastrointestinal like worms, coccidia, pwede rin sa lungs, like lungworms, and then pwede rin sa other parts of the body. So, pwedeng sa liver. Then, for externals, you have flies, lice, and grub. So, all of these itong mga parasites na to, it will be detrimental to the health of the beef cattle. It can reduce the productivity of the beef cattle. It can also reduce the quality of the meat. Lalong-lalo na itong mga internal parasites. So with that, the treatment and prevention for this, numerous anthelmintics, the wormers are available for yung mga internal parasites. And then for yung mga external parasites, may mga insecticides dyan na pwedeng mabili. So for the anthelmintics, pwedeng injectable, pwedeng oral, or pwede yung pour-on na tinatawag. So when we say pour-on, ipo-pour mo lang mismo doon sa animal. Then, one thing that you need to do is to decrease pasture contamination. So, pwede kasi yung most probably, yung naninirahan or yung life cycle for itong mga parasites na to, may stage dun sa life nila na they are living on grasses bago sila pumunta dun sa body ng animal. So with that, kailangan na you decrease the pasture contamination by first utilize effective dewormers properly. So dapat mag gumamit ka ng dewormers. Then utilize pasture effectively. So dito papasok ngayon yung pasture rotation na tinatawag, since one of the life cycle of a parasite, pag tumae yung beef cattle, tapos doon sa tae niya, meron siyang itlog. Merong itlog ng parasite. Then, yung parasite na yun, mabubuhay doon and then mag-hatch and then mabubuhay doon sa mga grasses. So, kung hindi ka mag-practice ng pasture rotation, yung mga eggs na yun, pwedeng i-ingest na mismo, or yung mga hatch eggs, yung hatch parasites na yun, pwedeng ma-ingest na ngayon ng mga other animals on the herd, other beef cattle on the herd. So, it will result to it having parasites na. Then, you also need to practice the drug pastures na tinatawag, and then monitor stocking density of pastures. So, kailangan na hindi masyadong malaki yung population ng herd when compared to yung sa size ng pasture. So, kailangan talaga na correct yung stocking density in order to prevent rin yung proliferation, yung pag-multiply nitong mga parasites. So, with that ends my discussion, video lecture discussion on the health management and then the common diseases of beef cattle. So, with that, please listen to it, and then please go over it if you have any questions. And then please review this video lecture. So with that, thank you for listening and have a good day.